I'm getting a live indicator, but
I'm getting
I also get
one like this in a circle.
same. Yeah. Oh, maybe we're good.
Yeah, it is.
I think we're good now.
Mhm.
All right, awesome. Well, for many patients, healthcare feels like a factory that whitewashes problems with pills and churns out one-size-fits-all solutions with surgery. I'm Dr. Danish Maslamduz, a native Kentuckian and medical director of Wellward Regenerative Medicine. As a Johns Hopkins trained double board certified anesthesiologist and regenerative pain specialist, I believe it's time to revive the caring spirit of healthcare and offer you, the patient, the healing that you deserve. This 50 Shades of Pain show is one way we empower you to receive sustainable treatments for injury and pain without surgery, addictive medications, and without being a victim of the system designed to work against your healing. Start your healing journey today at wellwardmed.com. So today I'm with my co-host, Dr. James Escaloni, who serves as a physical therapist, physician extender, and a biomechanical expert here at Wellward Regenerative Medicine. Like myself, he's seen firsthand countless patients who have suffered unnecessarily, not for lack of qualified or caring doctors, but from a broken healthcare system. So, James, what are we talking about today? And by the way, folks, we are trying something new here because I'm on vacation over at my little sister's house. And yeah, I'm going to show her. She's over here.
Hi.
If I can get it in focus. Oh, it's terrible view. Terrible, yes. See, everybody's seeing your house. Nobody can actually see anything. It's all out of focus. Yeah. Anyways, yeah, so I'm here over at my little sister's house in Washington, D.C., and James is still over there holding down the fort at Wellward. You can see the lobby right there. So, James, what are we talking about today?
Today is going to be an amazing episode. We're going to help so many people. We're going to be talking about ketamine therapy and how this can help people get deeper into their mind and body relationships. Okay, so here's the intro for everybody. Think about this and listen in. This is talking to you guys. So, with chronic conditions that can strongly have affected your life, the mental and physical pain you feel can overlap quite strongly. So, think about, for some people, the thought of getting out of bed is exhausting, and that actually brings on real legitimate pain, not made up pain, it's real. Now, for some other people, they can have felt so down that they can't even motivate themselves to move and enjoy the day. And other times, after mentally scarring events, it seems like it's difficult to get focused or have a purpose. So, any of these people, if it seems like I'm talking to you or maybe a loved one, then this show is for you. Why is that? Because we are talking about ketamine and what it can do for those people. So, Dr. Danish, let's hear a little bit about ketamine. What exactly is this stuff?
Yeah. You know, this is one of those sexy new treatments because it's getting a lot of press and media coverage. In fact, one of our friends, Allison, who's a professor of French down in Berea, or Center College, down in Danville. Yeah, I know, I mess that up every time. Sorry, Allison. She sent me an op-ed in the New York Times where a reporter was talking about her experience with depression and how ketamine was just such a big game changer for her. And this is something that we've been exploring and experimenting with for years, but my exposure with ketamine goes back all the way to when I was training as an anesthesiology resident. It's one of those medications that's used in anesthesiology for the most part, but it really never gained favor because it's a very difficult medication to dose properly. Because when it's done improperly, it can overshoot and people can actually have like a major, hallucination and very uncomfortable experience. But when it's done appropriately, it has this fascinating effect on the brain that pretty much resets a lot of parameters in the brain. And I've got a little explanation that I can go through. I'm going to share my screen, James. You tell me if you're seeing this properly, okay? All right, can everybody see, can you see my screen with the nervous system?
Yep, I see the nervous system right there.
All right, so the way the nervous system works is you've got tiny little nerves out in the periphery, and these are constantly sending messages up through the spinal cord and up into the brain. When it gets to the brain, I gotta hide some things in order to be able to see the brain. Actually, let me do this. There we go. Oops, too far. All right, so when the signals get to the brain, it goes through a section called the midbrain. This area right here, let me get rid of this one too so you can really see the midbrain. This area here is the midbrain. Even in the most basic nervous system in the animal kingdom, every animal has a midbrain. Like, you know, we talk about dodos as being dumb birds. We say you're a dodo brain. And it's not because they are actually stupid. It's just because we have a cerebral cortex, this guy right here, that many other animals have an underdeveloped version of. But every single animal has what we call the midbrain. And this is kind of the interface between the thinky part of the brain and the feeling part of the nervous system, or the movement part of the nervous system. So this is the main relay for the rest of the body. And it's at this midbrain where you get a lot of activity from ketamine, because every signal has to go through this to get to the thinking part of the brain, and every thought has to go through this to have an impact on the rest of the body. So things like, you know, your breathing rate, your heart rate, the level of anxiety, the readiness for running away or fight or flight response, everything is controlled in that midbrain. It's the interface between our body and our brain. So you can imagine that at that interface, there's a lot of things that take place. Mood is regulated at that midbrain section. Pain is regulated at that midbrain section, meaning that pain signals, when they come in and they want to reach your thinky part of your brain, they have to go through the midbrain, and the midbrain decides, is this a message important enough to be sent to the main brain, to the thinking part of the brain, or is it a message that it needs to quash? So that's why this midbrain is so important in regulating both pain and mood. And that's exactly where ketamine takes its effect.
Okay.
Does that make sense? So, like, for instance, if you're dealing with a chronic pain or chronic mood disorder, what ends up happening is at that midbrain, you start to deplete the resources available. And what's interesting is that because that midbrain is one system, if you deplete the resources with a physical pain, then people start to get depressed because there aren't enough resources available to feed the emotional side of the brain. So your physical pain system and your emotional pain system are drawing from the same pool of resources. And when that pool of resources is depleted, there isn't enough resources for either side, and they both compete for resources. That's why so frequently pain and depression go hand in hand. Now, what ketamine does is it creates a disconnect, so that thinky side of the brain and that midbrain, that regulatory part of the nervous system, they separate out. And it allows for both systems to just get some room to breathe. Kind of like when two people fall into an argument and you split them up, they're allowed to cool down, and then they start to think of things rationally as opposed to emotionally, and they're able to figure things out. Ketamine does the same thing. It separates out the functions of the higher brain, the thinking part of the brain, from the lower brain, which is that regulatory part of the brain, and gives them some space to reset. In that space, people feel, they often feel a sense of being disconnected or being distanced. They're able to think about issues and problems that they've had in an unemotional, unbiased way. A lot of the guards that we create for ourselves, you know, if I've had some major emotional difficulties in the past, people often create a wall around that emotional challenge because it's difficult to function on a day-to-day basis when that's in the forefront of your mind. Versus if you can create a wall around it, then it becomes easier to function. And then periodically, if it's appropriate, you come back and revisit those hardships to figure out how you can deal with it. Well, ketamine allows for that, and it enhances that by creating that separation between the thinky and the feeling side of the brain. Gives you an opportunity to really look at things from a very unbiased, unemotional perspective, and see things in a very different light than we had before. That's why we use it for both the pain and the depression issues.
So I think for the ketamine, I think I've heard it once described that it's kind of like if your mind's kind of stuck on this broken record of pain and depression, and then you're depressed because you're in pain, and then you get depressed more because things hurt, and then everything hurts more because you're depressed, kind of like this. It's a broken record. That ketamine could be used for people stuck on that roller coaster. Was that accurate?
Yeah.
Helpful?
I think that's accurate, but it's a little bit more complex than that. So if you look at the psyche of who we are, how we think, how we react to different responses, every single one of us has biases, has preconceived notions, has emotional tendencies toward certain things. Like, if, for instance, when I was a child, I was attacked by a dog. Well, every time I see a dog, I'm going to have a reaction, a negative reaction, and it's outside of my control. It's that part of that fight or flight response that builds up because of those exposures, and that's where all of those emotional triggers are stored in that midbrain. So your reactions to different things that have burned you in the past or have uplifted you in the past, those memories are stored in that midbrain. And when we encounter patterns or repetitions in life, it often interacts with that middle part of that brain and triggers us in ways that we don't quite understand. I have this analogy that it's as if we're all born on a boat, and we're not aware that we're living on that boat, but that boat moves and it sways, and there are waves that make it go up and down. We only see the soup bowl flying across the table and hitting the ball, but the physics of it don't necessarily make sense unless we become aware and conscious of the fact that we're actually in a boat, and our emotions are the waves. Our emotions are what shifts us and sways us left and right in ways that we're not even necessarily conscious. When we have these reactions that we don't quite understand or we don't know where they come from, there's usually something deeper to it. But again, our brain creates walls around things that have hurt us in the past. And so because of that, we often section off those parts and we're not quite aware of it. People who deal with chronic pain on a regular basis will often section off parts of who they are, parts of their identity, because they're struggling to just maintain normal function in the context of pain. And progressively, they start to, reduce the times that they go out with their friends or interact with them. They reduce the exposures they have to different sports and activities. And what's gradually happening over time is they are cannibalizing parts of who they are, parts of their identity, in order to accommodate the pain. And that's in and of itself a traumatic process, because in effect what's happening is they're building walls not around traumatic events in their past, but really around themselves and the things that they love to do. And because this is all taking place in that midbrain, that part of the brain that's not really conscious of thoughts, a lot of that takes place without us being necessarily aware of it. We have these kind of mood swings and depressions and anxiety over issues that don't really seem like they should make us that depressed or anxious. But it's all happening in the subconscious, in that middle brain, where it's outside of our visibility or outside of our control. The utility of ketamine is that because we have these biases, and when you're talking about the brain and how you think, these biases are self-defeating, they're self-fulfilling prophecies. We're not necessarily conscious of all of that, and so it becomes very difficult to access those walled off sections of who we are unless we gain that visibility or that distance that ketamine allows for. So I always tell patients that, I'll finish with this. I know I've been rambling off.
No worries.
But I always tell patients that there are two aspects to ketamine. One is a chemical reset. It's that space created when you're taking two parts of the brain, two parts of the nervous system. You're allowing them to get a breather from each other and start to refresh and rethink. The other part, though, that nobody else I've seen in literature doing is what we're doing here at Wellward. And that's that very unique psychodynamic exploration, that existential deep dive into who we are, the walls that we've created for ourselves, the barriers we create, and how that perpetuates pain in so many different ways. We had a patient just recently who came in with chronic headaches, and she's been dealing with a lot of anxiety issues. And when we kind of did this dissection, it just became clear how much the anxiety influences the headaches. Because if you think about it, when you're anxious, you kind of scowl, and your ears pull back, and your whole head becomes tense. Well, you've got all these nerves traveling through those spaces, and when you're in that chronic scowl phase, it's tugging and pulling on all of those nerves and generating headaches. Well, that happens all over the body. When you're dealing with emotional influences of the body functions are affected by that, and in ways that it's not always in the conscious part of our brains. So figuring out, tapping into how much our emotion, our subconscious, our psyche influences our bodies, and vice versa, how much the expression of our bodies, how much the pain that our body is expressing to our brains influences our moods and the way we think, the way we act in our environment. All of that is heavily interconnected, and ketamine has been a massive tool for us to tease these elements apart and really start looking at things in very unbiased, structured ways, and identifying some of these triggers that are otherwise invisible to healthcare.
So it sounds like also that people may not realize that they're really needing this, but their loved ones might recognize that they're not the same person they used to be before they had some, right?
Yes, absolutely. And people often do realize it. I mean, kind of the divining rod question, or the litmus test that I ask patients is, tell me a little bit about yourself, about your identity, about who you are, who you envisioned yourself being at this stage in life, who you envision yourself being 5 years, 10 years down the road from now. And do you feel like you're living the path of your optimal self? The moment I ask that question to somebody who's felt distanced from who they are, from their identity, I mean, their eyes well up. It's not something people can mask. They can mask it for the majority of people when it's on a superficial plane of existing and interacting, going to the grocery store, taking care of each other. But when it comes down to really self-reflecting on who we are as an identity, our self-awareness, our vision and compassion for ourselves, if you're not living that optimal life, it's evident. I mean, people will feel it the moment I ask that question, and it's so pronounced that it's moving every time, every single time. If I had the opportunity to at least explore that with every single patient and do that existential deep dive where we're able to strip away some of these defenses, some of these guards, and really look at that person as an identity, there's so much revelation to it. It's profound. It's absolutely profound. It's maybe one of the most magical things that I do.
This is pretty amazing to hear about. And I really wish there was some way that we could communicate to people that their mental health is just as important as their physical health, but try to get away from this stigmatization of that we're not just talking about your feelings here. This and this or this. I don't know how
a lot of people
talk to people about that.
Yeah, a lot of people have this notion that when we go in that direction, when we talk about it, it's like a wishful thinking of you can will pain away. And that's not at all what we're saying. It's that midbrain is such a key area that a lot of regulation takes place. Like, why is it that when you get a paper cut and the moment you go back to work and you get distracted, you're no longer thinking about that paper cut. But the moment you notice it again, or the moment you get some lemon juice on that paper cut, it's like a glaring, angry pain that you become aware of again. It's because that midbrain is able to filter out painful sensations in regards to the priorities that we're addressing, or the priorities of the thinky side of the brain. So there's this back and forth influence that's constantly there, and it's constantly reverberating and echoing throughout our nervous system. But if we're only attending to the physiology of the damage, the tissue damage, the pain that's being created, and we ignore all of the other aspects of it, well, our nervous system our peripheral nervous system learns just as how our brain learns. And if it learns that this is a painful behavior or painful area of the body, even when you get rid of the damage, even when you eliminate the cause of pain, you can have a perpetuation of that pain just by sheer changes in the nervous system. So if we're not attending to the whole spectrum, the whole chain from tissues to spinal cord to brain, if we're not looking at that whole system when we're dealing with a chronic pain, we're missing the boat. We're missing major gap. We're creating major gaps in our healthcare system, and that's literally exactly what has taken place over the past 30, 40 years in healthcare, is we've fractured these different systems into different specialties. So you go here for neurology, you go here for psychiatry, you go here for pain management, you go here for orthopedics. But there's not this continuity building this understanding of how much each of these different systems interact and relate with each other. It's only when you bring all of those elements into one institution and you start really looking at how pain affects the body, not in, I stubbed my toe and by, Wednesday it's back to normal, but rather, hey, I stubbed my toe, but it's not going away, and it's been like 6 weeks since I did that. Those are the situations in which that reverberation throughout the body, from tissue to spinal cord to brain, those reverberations are taking place, and there's something awry that needs to be understood before that person can get better. That's where things like our innovations around ketamine, our ortho-regeneratives, our use of you, James, as our biomechanical expert, all of that is integral to figuring out the chronic pain question. And I really do believe that we are developing the answers at Wellwork.
Wow. So if, let's say I'm a person and I'm thinking, this sounds like something that I could benefit from, can you take me through that process of what it would be like?
Yeah, I mean, the volume of people that could benefit from this is really large, first of all, because it's not just to treat depression, it's not just to treat pain issues. It really is a process of gaining clarity. The analogy I use is, it's like we all have a room that is essentially our burning room, is what I call it, where you go into that room and there's a fire somewhere in that room, but you really can't see in front of yourself because there's so much smoke. Our tendency is, if we can find the fire, we can put it out, everything will be okay. But when there's so much smoke in there, we're only going to be stumbling around trying to find the fire, let alone put it out. Ketamine essentially vents the smoke. So if you can vent the smoke and you can see the fire, now you can put it out. So it's a mechanism for gaining clarity on what's going on. The way we go about it is, we first do an assessment, make sure there aren't any reasons we shouldn't be doing the infusion. And if you pass all those metrics and we see that there's a rationale for its use and there's a utility, then we set up a series of infusions during which we start an IV. We set an infusion up corresponding to your dosage. Early on, I'm very involved if this is just an infusion without the psychotherapy deep dive, or what we call ketamine plus. If it's just the infusion, we'll titrate the dose to the appropriate level, because each individual is different. And that's based off of your vital signs, your experience, what you feel. All of that goes into figuring out the proper dosage. And then thereafter, we just kind of build off of that. But if we're doing a psychological deep dive, that's when things get a little bit more interesting, because we combine the use of an anesthesiologist who's well-versed in the use of ketamine and this process with a therapist. And sometimes I do both of those myself. And it allows for this really interesting exploration, because we're able to kind of fine-tune the medication dosage along with the appropriate questions to get at some of the root problems, and do so in a way that feels safe, feels embracing, feels compassionate.
Okay, very interesting. So what
Yeah.
are some results that you've noticed for people who've had maybe some difficulty with getting over the pain after it seems like the body has been treated?
You know, that's a lot of times where the problems lie, is because sometimes what happens is the peripheral nervous system has developed a memory around that pain, and so it perpetuates the sensation of pain until some of these mental blocks or until some of these walls are taken down. I'll give you an example. If say for instance somebody uh, is in a relationship that they're not very happy with. However, when they're hurting, their partner gives them the love and affection that they need. Well, over time, and I'm not talking about like days, I'm talking about years, over time, what can happen is you develop this mental identity around, I can receive, I'm worthy of affection, or I'm recipient of love when I'm hurting, when I'm injured. But this becomes a wall, this becomes a barrier that limits how much progress you can make with that patient. Even if we're able to eliminate the physical causes of pain, that emotional connection to, you know, I am valued and loved when I'm hurting becomes a major detriment to getting better. Even when they can rationally feel it and experience it, it's not that they're making it up, it's not that they're lying about it, it's that we have these cognitive dissonances where if getting better means losing affection, well, we all need affection as kind of one of the most basic food groups in our world. Is we need affection, and if somebody takes that affection away from you, that's like a stronger motivator than drugs or food or even air. We need affection more than anything else. So you can imagine if it's that powerful of an influence, well, it's gonna powerfully limit how your brain can adjust to the lack of stimulation from that pain pathway. Like if the pain pathway was completely eliminated, because those nerve patterns are set up in the brain, they're going to perpetuate unless we get to that bottom root cause.
This is absolutely fascinating stuff. And I'm just starting to think in all the people over the years that I've treated that if I had access to this, I could have helped them so much more because I did all I could from a physical rehabilitation standpoint, but there was just something I couldn't get over the hump.
Well, I completely agree with you, James. I mean, there's so many times where it's the psychological element of it, it's the biomechanics of it. Like we've talked about ligaments in the past, how much ligaments are undervalued and underrepresented in healthcare. There are so many tiny little gaps that could prevent somebody from getting resolve around the chronic pain issue. And our healthcare system has for such a long time been set up around mitigating the symptoms rather than really dissecting the problems and understanding the root causes. That's where I feel like we're really making some big strides. I mean, ketamine has been a major game changer in how we practice, but it's not the only thing that has been a game changer. I think there are a lot of aspects of what we do that are filling in the gaps and building the bigger picture. But by all accounts, I think it is one of the most fascinating aspects of what we do. People routinely tell us that it's as if I've gotten 20 years of therapy all at one time. I mean, that's a statement that I've heard from multiple people, and it's not one that I've seeded. Like I've said that, it's random people will tell that to me, that they've gone through, you know, years of psychotherapy or years of psychiatric care. And some of the insights that they have during these ketamine plus sessions have been profound, like life-changing realizations.
Amazing. Well, I think we talked a lot, so let's try to do this. Let's give maybe a 30-second summary of who ketamine is good for of patients, and maybe what it like how it works. Just 30 seconds to a minute. Boom.
All right, 30 seconds.
Yeah.
Ketamine is a medication that creates a separation among the different nerve systems, the thinky part of the brain, the autonomic or the feeling part of the brain, and then the spinal cord. because of that separation, you're able to look at issues from a very, very different set of eyes. So people who are dealing with chronic pain, people who have been dependent on opioids, people who have alcoholism, people who have chronic neuropathic pain, all of these people can benefit from that nervous system reset, that shutdown. But and on top of that, people who are seeking internal clarity, people who are struggling with something they can't quite realize. I've even had executives or CEOs who they get bombarded by different stimulus, different questions on a daily basis, and it can be overwhelming and fatiguing. So even people in those capacities who are seeking clarity can benefit from ketamine. I know, more than 30 seconds. That wasn't a good 30 seconds.
It's all right. 30 seconds on your time. That'll work. It sounds like
so the 10-second version. Say again?
Oh, I said it sounds like this really fits in with the HEAL methodology Wellward has then.
Absolutely does. I mean, the first step of HEAL is hearing the messages your body is trying to convey with pain. Ketamine is really profoundly effective in helping us figure out what is the body trying to say, like how much of this is physical, how much of it is psychological, how much of it is autonomic, meaning like the regulatory systems of the body. And that it can be really helpful in teasing all those apart.
Okay. What's that HEAL acronym stand for again?
It's hearing the message your body's trying to convey with pain, envisioning what life is meant to be like, alleviating some of the symptoms, and then leveraging what your body normally does to repair in a way that otherwise would be limited or slowed.
All right. I thought I heard that someplace before. All right.
Conceding.
Perfect. Okay.
Well, I think our time is up. I want to thank everyone for watching our 50 Shades of Pain show. Each patient is different, and there are numerous factors that contribute to your pain. In the same way, we recognize each patient as an individual and create treatment plans that are designed specifically for your health. Our Wellward team looks forward to partnering with you. I'm Dr. Danish.
I'm Dr. Escaloni.
And we encourage you to start your healing journey at wellwardmed.com. Bye, everyone.
Bye.